Hi, I'm Alexis Hunter, Community Liaison for Wilmington Health. I'm joined today by the providers on our orthopedics team. We want to take some time to introduce you to this group and learn what our experts have to offer to our patients. Today, I'm chatting with Dr. Claude Jarrett, Dr. Chris Jarrett, Dr. Chad Fortune, Physician Assistant Rebecca Sutphin, and Family Nurse Practitioner Josh Ellerbrook. Team, please take a little bit of time to give us some background information on yourselves, including your education and your expertise.
My name is Josh Ellerbrook. I have an undergraduate from UNCW University, and I have my master's and my doctorate from MUSC in South Carolina. The patient population I really enjoy seeing is pretty much patients of all ages and backgrounds. I really have enjoy variety.
I'm Rebecca Sutphin, PA at the Jacksonville office. My background is my undergraduate is from East Tennessee State University, and I got my PA degree from Jefferson College of Health Sciences in Roanoke with a master's through University of Nebraska Medical Center. I do enjoy pediatric fractures as well as the adult population, including arthritis and sports injuries.
Hi, everybody. My name is Chad Fortune. I'm an orthopedic surgeon. I'm very excited to be part of this very talented and dynamic and amazing team at Wilmington Health. My background is a bit unique in that prior to medical school, I was a physical therapist. I worked for just over 5 years, so I have a keen interest and understanding in the non-operative side as well as the recovery after surgery. My medical school training began or completed at Case Western Reserve University in Cleveland, Ohio, and that's also where I did my orthopedic surgery residency. I then did a specialized fellowship year in Los Angeles, focusing on minimally invasive surgery, arthroscopic surgery, reconstructive surgery, and sports medicine. I have a special interest in hip preservation surgery, which is through hip arthroscopy. I enjoy seeing patients of all ages, from birth to grave, all orthopedic injuries and conditions. And I look forward to seeing each and every one of you in the future for any of your orthopedic needs. Thank you.
Hi, everybody. My name is Claude Jarrett. Actually, I finished my undergraduate degree in biochemistry from Xavier University, after which I went to medical school at Northwestern University in Chicago, Illinois. I've completed my orthopedic surgery residency and training at Emory University Hospitals, followed by a fellowship in hand and upper extremity reconstructive surgery at Allegheny General in Pittsburgh, Pennsylvania. After my fellowship training, I returned back to my alma mater where I went on faculty as an assistant professor for orthopedic surgery before joining the group here in Wilmington. I have a particular interest and expertise in addressing problems of the hand and upper extremity, including nerve, tendon, ligament, and joint injuries, both acute as well as post-traumatic injuries as well.
Hi, my name is Christopher Jarrett. I'm another one of the orthopedic surgeons here at Wilmington Health. I was in a prior life a chemical engineer. I got my undergraduate degree from Georgia Tech, Go Jackets, before going back to the University of Mississippi for medical school. Then I did my residency in orthopedics at the University of South Alabama before spending a year in New York City at Lenox Hill Hospital, where I specialized in adult reconstruction. That's my subspecialty interest in hip replacements and knee replacements.
Thanks so much, team. Dr. Claude Jarrett, injuries and breaks can happen at any time. The first instinct is to go to the emergency room. What is the ortho team at Wilmington Health doing to help patients avoid an ER trip?
Yeah, that's a great question. You know, we in orthopedics, we wholeheartedly appreciate the fact that when a musculoskeletal injury or ailment occurs, it's a pretty stressful experience, both for patients and their family. You know, our regional ERs are often overwhelmed with high acuity and very ill patients. As a result, your orthopedic injury may be downgraded on their priority list just based on necessity. Fortunately, teaming up with the Wilmington Health Today's Care Plus clinicians, we are actually able to bring aspects of emergency orthopedic care to a more relaxing outpatient experience. we work with our communities to provide timely orthopedic access. You know, our orthopedic surgery and sports medicine specialists are able to provide thorough evaluations, begin your treatment, and start coordinating your care on day one. There's no need to refer you to another center where that new provider may have to start evaluation from scratch. You know, as a result of our access and our cohesive practice, we are able to really provide high quality care at a fairly cost-effective approach. So definitely, we love the ability to kind of get patients well taken care of, start their care early, and really facilitate their care until they're back to their prior level of function activity.
Rebecca, outside of immediate injuries, how can someone know it's time to see an orthopedic specialist?
Well, that is a very good question, and that's a little tricky. A good rule of thumb is if you are having pain that persists after you stop an activity, more than 20 or 30 minutes, then it would be a good idea perhaps to have it evaluated. A good instance would be if you have knee arthritis, for instance, and if you have intermittent pain, you can manage it at home, that's okay. But if you have day-to-day pain that limits your daily function, you have worsening pain, or you're having difficulty with your normal activities of daily living, then please come in.
Good to know. Dr. Fortune, if it's necessary to have surgery, what can a patient expect from prep, the day of surgery, and then recovery?
Thank you, Alexis, and I'd be happy to discuss this more. I first want to make sure that everybody knows that just because surgery is in our name, our goal and our hope is that we can often treat these conditions without surgery. And typically we can. We have a whole slew of tricks and treatments that we can offer to you that we'll be discussing later on today. And most of the time we can achieve our goal without surgery. But certainly if surgery is necessary, we are a team that can handle any and all of your surgical needs. Just as Dr. Claude Jarrett had mentioned, we take this very seriously. We understand that this can be a very stressful time in your life from a financial standpoint, a job standpoint, a family standpoint. And a lot of us have had orthopedic surgeries or other surgeries, so we can intimately understand this. And our goal is to make this as seamless and as stress-free as possible. And in doing so, we do that through open communication. We really want to inform you, the patient, of your needs and expectations, and we want to hear what your goals are and what you want to get back to. And if all of that lines up for surgery, then that's something that we will indicate and discuss. If that's the case, then we will have you work with our nurses and our assistants to find a time that's appropriate for you. We'll see you for a preoperative appointment where we'll go over all the details of surgery. We'll talk about the expectations for recovery. We can go over scientific literature and evidence-based medicine and tell you why this may be the best situation for you. But ultimately, you, the patient, are going to be the decision maker. And we want you to know that you are in control of your health care, and we are there to assist you and to provide you a path to recovery and back to an enjoyable lifestyle. So if we get to that point, we'll see you for the pre-op. We'll get you ready for surgery. We'll see you on the day of surgery. Often you'll get there a couple hours beforehand to meet with the anesthesia staff and the preoperative nurses. We'll talk to you that morning. We'll go ahead and take care of the surgery. We'll talk to your family afterwards. If it's an outpatient procedure, we'll see you back in the office typically in a week or two after surgery. Same for an inpatient procedure, but you may be there for a day or two. Often at the postoperative visit, we'll talk about dressing and changes and medicine, and we'll go over all the rehab and kind of expectations that will occur over the next couple months. But we want you to know that we're there with you through the entirety of it. We have somebody that's always available 24/7 to you to call and to reach out to. We have wonderful nurses and assistants that are there during the day at the office that can answer any and all of your questions. So we really expect that if we indicate surgery, we'll get you to the point of returning to life as you want to live it. And we hope that we have the opportunity to serve you when that time arises.
Josh, How does Wilmington Health Orthopedic Surgery treat children with broken bones or orthopedic injuries and conditions?
Well, that's a great question. As we said, kids especially, any type of orthopedic injury can be a very scary and stressful time for anyone. But when it comes to children, it's a scary time for them, but it's also a scary time for the parents. And we often, we take pride in being able to see those kids in a very timely manner, often the same day as when those injuries occur. I know that all of us providers here at Wilmington Health Orthopedics really try to make sure we take the time and explain the details of the injury and all the possible treatment options, so that not only is it comfortable for the child when they're injured, but also so the parents feel comfortable with all the treatment options that we have to offer. We look for the best possible outcome, and because kids are growing, and we want them to thrive for the rest of their lives.
That's great. And Dr. Chris Jarrett, what types of non-surgical options and treatments could a patient receive at Wilmington Health?
Well, that's an excellent question. And sort of to go back to what Dr. Fortune was mentioning earlier, it's a common misconception that because we are orthopedic surgeons, everything we do involves surgery. In fact, probably 75 to 80% of the patients we see, or even higher, can be treated non-operatively for whatever their injuries are.
Wow.
Most of the things we see, from ankle sprains to broken wrists, can be treated non-operatively. Sometimes they may require a little bit of a manipulation before they're put into a splint or a cast. And occasionally they'll require surgery. Some of the more degenerative things, such as arthritis, those can be treated non-operatively as well, until it comes to a time when surgery is necessary. For the degenerative processes, that can range from injections, be they corticosteroid injections like prednisone or cortisone injections, as people call them, to the synthetic joint fluid injections, which we call viscosupplementation. These could be the synthetic joint fluid. Some patients call them the rooster comb injections. Anything to help keep them comfortable and functional. We also use a variety of braces to help support joints from the knee to the wrist. And physical therapy is always a great option for keeping people active and mobile and healthy.
Thanks. That's great. And this last question I'll ask to Dr. Fortune and Dr. Claude Jarrett. Can you share what you feel makes the Wilmington Health orthopedic experience stand out in our community?
Thanks, Alexis. I can field that question first. I think first and foremost, it's the care that all of us providers will provide to you. We all take great time with our patients and have their best interest in mind. Our access to care is also something that's very important to de-stress a very stressful situation. We pride ourselves in getting you in the same day if necessary. We have multiple providers at multiple locations, ranging from, as you said at the beginning, from Wilmington to Porter's Neck to Leland to Jacksonville, and even down into Southport. Mm-hmm. So we feel like we can reach a lot of people and can be very helpful with their needs. We also have in-house laboratory. We have an in-house radiology department, so we can get CT scans and MRIs and advanced imaging when we need it. We do not have to send you elsewhere to do that. And also, most importantly, you don't have to have a primary care physician at Wilmington Health. You can come see us as subspecialists straight from your other primary care physician, and we're great about communicating back our plan to them and to make sure that we're all on the same team and all approaching things in the same way.
Well said, Chad. We remain committed to a very patient-centered orthopedic experience. Our close-knit group of orthopedic surgery and sports medicine specialists, we bring a fellowship-trained advanced techniques here closer to home. Our surgeons are dedicated to being at the forefront of orthopedic technology and services. Whether you are relatively new to the community or lifelong residents, we're proud to continue the great tradition of orthopedic care in the Wilmington area. We know that with a lot of these injuries, it's a very long process to get you back, but we're committed to that, and we'll continue to do whatever we can to keep you busy, active, and get you back to your usual independent self.
That's great to know. Team, this has been so informative, and I'm sure that those that are viewing think the same. And to our viewers, if you or your child need to see one of our orthopedic specialists, please visit our website to learn more or contact any of the locations mentioned to schedule an evaluation. We look forward to providing the highest quality of care to you and your family. Thanks so much.